Can radiographers be trained to deliver an intervention to raise breast cancer awareness and thereby promote early presentation of breast cancer in older women? Hello everyone, today we're going to dive into an article by Omar, Burgis, Tucker, Wellhan and Ramirez from 2009.
Let's begin with the background of the study. Survival rates for common cancers in the UK lag behind those in other European countries. Specifically, breast cancer survival rates are adversely affected due to patients presenting with advanced stages during diagnosis. Because of this, the researcher has developed the research problem, which is whether radiographers can effectively convey key messages to encourage early presentation of breast cancer, ultimately contributing to improved survival rates. This research aims to assess the feasibility of training radiographers to deliver a one-to-one intervention to raise breast cancer awareness among older women. This study is significant to older women, radiographers, and the healthcare system. Now let's move on to the methodology. First, there are 4 radiographers who were interested and trained for this intervention. Their engagement with women was initiated at South London Breast Screening Services. The recruitment process involves informing these women about the study, and their consent was procured at the clinic. To maintain consistency and control, all interventions happen in static breast screening units within private rooms adjacent to the clinic. This environment ensures the standardized delivery of the intervention. The intervention also provides women with booklets containing key health-promoting messages. This serves as a tangible reminder and resource for the participants, reinforcing the essential information shared during the intervention. The evaluation methodology encompasses comprehensive before and after measures, specifically in determining the confidence of radiographers in various key components of the intervention. This includes their proficiency in imparting information about the symptoms, as well as their ability to handle signs of distress during information session.
Now, let us see the results of the study. Figure 1 shows the progress in achieving competency to deliver intervention over time for each radiographer. As we can see in Figure 1, Radiographer 1, 2, and 4 have achieved the minimum competency criteria, in which the percentage competency score for content and style have increased over time. Meanwhile, Radiographer 3 did not achieve the minimum competency criteria because the score for content has reduced over time. Next, Figure 2 shows the mean scores on self-reported confidence before and after the training period. We can see that the mean scores for all items increase over time. All radiographers gain more confidence in their ability to deliver the intervention in raising the breast cancer awareness. Even though all radiographers have improved their confidence, they express that they still have low confidence in their ability to handle unforeseen circumstances, and that more training was necessary to help them come up with plans to handle the unexpected situation. Now, let us see the positive benefits and challenges of this study. The radiographers reported that the intervention offered a chance for better communication skills and more contact with women undergoing breast cancer screenings. The challenges that the radiographers faced were first, having trouble to pick up the intervention schedule and presenting the pre-written health-promoting messages, and second, having difficulty in finding time to rehearse during their busy working schedule.
Next, we move to the discussion part. In this section, we'll discuss about the key finding of the journal and explore its implication, strengths, limitation, applicability, and how it affects us as students. So the study actually demonstrates the feasibility of training radiographer to deliver one-to-one interventions for improving breast cancer awareness in elder women. The training model is based on evidence-based technique, and it efficiently enhances the skill and the confidence of radiographer without disrupting the regular breast screening delivery. So from the research, we can see that its application on radiographer, which they show a positive response toward extending their role, indicate the enthusiasms, and the strength, which is the screening service, found the training acceptable and cover the arrangement during training were feasible, or in other words saying, the training will not discuss regular breast screening delivery like just now I mentioned. Every research has their limitations, And acknowledging the study limitation is imperative. There are 3 limitations stated in this journal, which is the first one is the small sample size of radiographer. There's only 4 radiographers selected, and as the participant was self-selected, generalizing this motivation to all radiographers in breast screening remain uncertain. Additionally, while the control environment ensures consistently, real-world variability in different screening settings must be considered. Following the discussion of limitation, a potential solution, or we call future direction, are also stated, which is to expand the sample size by residue more radiographer, thereby enhancing the study statistic power. And another proposal model involving experienced radiographer coaching trainee in a clinic setting or provide ongoing performance feedback are also one of the solutions. The journal also showed its applicability. Implementing the intervention in everyday clinical practice may require extra training time, which could affect how efficiently the NHS breast screening program runs. If it was proven cost-effective, they aim to simplify the training while keep it effective, make it more feasible and acceptable for screening service. Lastly, as students, what do we learn after reading this journal is inspire us to realize that these kind of interventions can be shameless integrate into our education journey. By understanding and practice the element of intervention more early, students like us may anticipate enhance the performance and have a smoother transition in our work in the future to help to increase the awareness of breast cancer among the elder women.